The reason that they recommend, like if you're on a long plane flight, to get up and walk around a little bit midway through the flight or so, is because you want the vessels to circulate the blood. You don't want it pooling in your legs. This can lead to something called DVT, deep vein thrombosis. So the dilated vessel itself is called a varicose vein, but if you have a varicose vein, the blood that's pooling in this area right here can form a clot. And once you start circulating that blood again, if that blood is clotted, it could go to your lungs eventually and prevent air from circulating in your lungs, which again is called a deep vein thrombosis. Okay? Any questions on this? All right. So let's talk about the different pathways of blood. This thing that we've been looking at right here is called the simple pathway. It's the normal pathway that we think about and talk about when we think of vessels. You have the heart, artery, capillary, vein. Simple, right? There are certain cases where this changes and you have what is called alternative pathways. So I don't like to read to you. This is a picture for all of those. So in a simple pathway, you see the heart goes to the artery, goes to a capillary, goes to a vein, what we're normally used to thinking of. Whenever you hear the word anastomosis, the word anastomosis means connection, okay, or junction between two vessels. So when you have an arterial anastomosis, it's a connection between two arteries. If you have a venous anastomosis, it's a connection between two veins. If you have, right here, an arteriovenous anastomosis, it's a connection between the artery and vein. You're basically bypassing that capillary bed, which is otherwise known as a shunt. Okay? So, you're like, why would we need this to happen, right? So think about, for example, the sympathetic nervous system, right? In the sympathetic nervous system, when this is activated, this is your fight or flight response. Where is blood going to? Is it going to your skeletal muscles? No. Yes. Blood is definitely going to your skeletal. If a lion walks in this door right here and is trying to eat you, it's going to activate your sympathetic nervous system, right? Your skeletal muscles are going to be activated so you can run away, okay? So what would happen is in the sympathetic nervous system, you would activate your arterial anastomosis so that more blood can flow to your skeletal muscles, right? But at the same time, if that lion is coming in here and trying to eat you, do you want blood going to your kidney to make urine? Do you need blood going to your intestine to digest your food? No, you don't need those actions happening at the time. So what they're going to do is they're going to activate these shunts right here. They're going to bypass the stomach. It's going to bypass the kidney or whatever, and it's going to go back to circulation and go where it needs to. Does that make sense? Okay, so it's basically ways to direct blood where you want it to go. Okay, now there's a special system called a portal system, and this is special because instead of the blood going through one capillary bed, it goes through two capillary beds, okay? Now, look at this right here. This first capillary bed, it changes from red to blue. What did we say the color red represented?
Oxygenated blood.
Oxygenated blood. And you can see that this blue is deoxygenated blood. So in this first capillary bed right here, gas exchange is happening. It's the normal capillary bed, right? But if we look at this second bed right here, it's blue blood going to blue blood. There's no gas exchange happening here, right? So you're like, okay, well then why do we need a second capillary bed? Remember we said there's other things in your blood besides gases. You have nutrients, you have wastes, you have hormones, you have all the different things. The purpose of this second portal system is to deliver those like nutrients or hormones or whatever, right? Now, we're gonna especially talk about something called the hepatic portal system. What does hepatic mean? What organ is that? Hepatic means liver. So, in the hepatic portal system, basically what's happening is your blood in your like intestines and your stomach and your spleen and all of those internal organs, the blood in there comes from basically like the food you eat, right? So if you're eating like whatever you're eating, you could have nutrients in there, but another thing is that could be in there are like bacteria, right? So if you are ingesting bacteria, you don't want that to go back to your heart. So what happens is if you have your small intestine, the blood is going to go first to the liver, and then it goes to the like inferior vena cava. So the fact that it doesn't go directly right here, this doesn't happen. It first goes to the liver. The liver is what cleans our blood. That's what's happening in the second capillary bed right here. Okay? So the whole purpose of the hepatic portal system is not gas exchange. It's to filter and clean out the blood before it goes back to that vena cava. Okay? Any questions on these different pathways? All right, so the next thing that we're going to talk about is blood flow, blood pressure, resistance, and all the different factors affecting them. So when we say the word blood flow, this is how much blood is flowing at a certain time. So it's like a rate, okay? Do you guys remember how we said in the heart, there's something called cardiac output? What is cardiac output?
Heart rate times stroke volume.
Heart rate times stroke volume. So that what that means is how much blood you're pumping out per minute, right? Blood flow is pretty much the same thing, but it's not in the heart, it's in your vessels. It's how much blood is flowing in your heart per minute, or in your vessels per minute, okay? Now, blood pressure is the force in which the blood pushes against the vessel walls. Okay, so we're measuring two different things: how fast it's going and like how much like force it's pushing. Okay, now resistance is an opposite force. It's the opposition to flow, and this is usually due to friction. Think about like a playground slide, right? In a playground slide, when you first start like at the top of the slide, you're going really fast, right? But this like imagine a really long slide. The further away you get from the top, like as you're going down the slide, you start to slow down. Why? Because your body is literally rubbing against that slide, right? And the rubbing of your body against that slide is called friction. It's the same thing that's happening in your blood. That blood is literally rubbing against this wall right here, and it's slowing it down. So that's called peripheral resistance. Does that make sense? So this right here, I know that you're like equation, math. I'm not going to make you do a math equation. The only reason I'm giving you this equation here is to understand the relationship of these parameters, not to actually calculate something out, okay? So first thing is F stands for blood flow, P stands for pressure, R stands for resistance, okay? So just the first letter of those words. So look at flow and pressure. Flow and pressure have a direct relationship. What does it mean to have a direct relationship? If one goes up, the other goes up. They go in the same direction, okay? So it makes sense that if you increase pressure, you're going to increase flow. If you increase flow, you're going to increase pressure. Like, the more blood there is, the more force there is, the faster it's gonna go, okay? Resistance, notice, right, is under here. It is inversely related to blood flow, okay? So inversely means that it goes in the opposite direction. The more resistance you have, the less flow you have, okay? So it is, you can look at this and like use the equation, but you can also think of it like intuitively. Like if you're like preventing blood from flowing, which is resistance, you're gonna have less flow, okay? Now, what we're gonna look at specifically in the next slide is this resistance right here and what causes resistance, okay? So there are 3 parameters that affect resistance. You have blood viscosity, total blood length, and vessel length diameter. And again, I know that this equation here looks scary, but I'm not going to ask you to calculate anything out. It's again just to show you relationships, okay? So first thing is viscosity. That's represented by this Greek letter nu right here. Viscosity and resistance are directly related. So what is viscosity?
Thickness.
It's a thickness or resistance to flow, okay? So whenever you think of viscosity, think about like the difference between water and syrup, right? Water flows really easily. Syrup is like very slow and sluggish. So your blood is viscous because it has a lot of like vessels and formed elements. So the thicker your blood is, the slower it's gonna flow, okay? Next is vessel length. Remember I said the whole slide thing? The more you rub against that slide, the slower you're gonna get. So it makes sense that the longer your vessel is, the more you're gonna rub, the more resistance you're gonna have, and the more, the slower your flow is gonna be, okay? And then lastly is blood vessel diameter. Look at this equation right here real quick. We're saying that resistance is directly related to viscosity, it's directly related to vessel length, it's inversely related to the radius, which is the diameter. But look at this right here. It's radius to the 4th power, right? So if we're trying to think about which of these affects your blood flow the most, which parameter is going to affect your resistance the most? The radius, because it's to the 4th power, right? So any tiny change in your radius is going to affect your resistance to the 4th power. That's a lot of change, okay? So this is, I really like this analogy that your textbook gives. It's showing you like the difference between like a milkshake versus water and drinking it, right? If you drink water through a straw, it's like gonna flow really easily. If you drink a thick milkshake, it's more viscous, it's thicker, right? So it's not gonna flow through that straw as fast, okay? Same thing with the straw size. Notice that this straw is much shorter than this one. So this is going to have, like, you're gonna be able to drink the shake faster with the shorter straw. But at the same time, notice that the width of this vessel, or this, not vessel, straw is thicker. So you're gonna be able to drink more shake through the bigger straw. So it's the exact same concept with your blood vessels, okay? Any questions on this? You need to know the relationships. If one increases, what will decrease, blah, 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 okay? The next thing we're going to talk about is arterial blood pressure. So we talked about this in lab. We said that systolic pressure was the pressure that you get when your heart is in systole. Diastolic pressure is the pressure when your heart is in diastole. And we said that the normal range, or the not normal range, but the normal reading is 120/80, which is systolic over diastolic. So, we'll come back to this in a minute. In order to measure blood pressure, this is what we again talked about in lab. We use what's called a sphygmomanometer. It's just a fancy word for blood pressure cuff. Okay, so this right here is showing you that blood pressure cuff. Remember, we said that it's the whole purpose of this is to inflate the cuff to cut off your brachial artery. Okay, so as you are inflating it, that pressure is going to rise right here. And then when you turn this valve, it's going to slowly let the air back out, and you're going to see that this pressure is going to decrease. As this is decreasing, notice that he has the stethoscope. You're listening to that artery. If you've closed an artery and you're slowly opening it, as soon as it gets wide enough, that blood is going to forcefully go back through that vessel. So that like violent force, that turbulent force of the blood flowing, you can hear audibly in the stethoscope. So you mark the beginning of that sound, where it's usually at about 120. You continue to listen until the sound disappears, which will be at about 80. Okay? So when you're measuring blood pressure, you're listening for what we call Korotkov sounds. It is not two different sounds, it's one sound. You're just listening for the beginning of it and the end of it. Does that make sense? Okay. And I want to point out that a lot of times you guys will try to like listen and try to do the blood pressure, and you're like, I don't hear it. You're expecting this like big like pronouncement of a sound. It's a very subtle tapping sound. You'll hear like a faint tapping, and then it'll start to fade and fade and fade and get quieter. Okay, so this is a clinician's trick. This is not, they'll tell you not to do this, but it works anyway. If you're listening for the sound, but another trick is to look at the needle. When it is like above the systolic pressure, the needle will move slowly. As soon as the blood starts pouring through that vessel, you're going to see the needle bounce. So the beginning of the bouncing is the systolic pressure. It's going to bounce, 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 bounce. And then it's going to stop bouncing. When it starts going like smooth flow again, that's the diastolic pressure. So like if you're in nursing school, they're going to tell you not to do that, but in real life, they do it. So it's just a little like trick. Any questions on blood pressure? Now, pulse points. So think about the heart is contracting and relaxing, contracting and relaxing, contracting and relaxing. Every time the heart contracts, it's shooting blood. And every time it relaxes, the blood flow relatively slows down. So you have like this pulsatile flow of blood. When we look at blood, you're basically feeling that the blood surging through your vessel, and we can measure it to determine heart rate. Okay, so in lab, I stated that the definition was it's a palpable heart rate. The word palpable means that you can physically feel it. Okay, so these are the different common pulse points. I think there's 9 on this picture. In lab, you only needed to know like 7. But you can see that the most common area that we measure pulse is the common carotid. Now the reason that this is the most common is because this is the artery closest to the heart. Okay, so it's going to give you the most accurate reading because it is closest to the heart. The second most common that they use is the radial artery, which is on the lateral side of your wrist right here between your 2 tendons. If there is some sort of injury to the upper half of the body and the clinician can only get to like the lower half, the most common like pulse that they'll use in the lower half of the body is this dorsalis pedis pulse right here, because this is the easiest one to palpate on the foot. Okay? And that's pretty much it. Any questions on these? I mean, there are other ones as you can see, but those are the ones that use the most. Okay. So this is just showing you the difference in blood pressure in the arteries versus capillaries versus veins. Between arteries and veins, which is a high pressure system? Arteries, and we said that veins are low pressure system. We're actually seeing that here on this graph, okay? So we're seeing that in arteries, you can actually tell the difference between the systolic and diastolic pressure. So you can see that there is literally a difference, 120/80. The further we get from the heart, then you can see that the difference between these two pressures gets smaller and smaller and smaller, because overall the pressure system is decreasing, until eventually you can see that when we get into the capillaries, it almost drops to almost zero, and by the time you get to the veins and venules, it's like very, very low pressure. It's almost insignificant pressure in this system right here. Okay, so the reason that we want this pressure to drop is A, we're moving further and further away from the heart. But second of all, A and B, if you think about the vessel walls, we said that closest to the heart, you have your elastic arteries, right? So you're gonna have that big stretch and recoil. What are your capillaries made out of? Like, what is the wall composed of? Simple squamous epithelium. Do you think that simple squamous epithelium is going to be able to withstand that high pressure system? No, it will basically rupture every single vessel if you continue to have that high pressure. So what happens is it like you increase in surface area and it decreases that pressure as you like spread it out to your capillaries, okay? So this is just explaining that we talked about how your veins are your like reservoir. This is where we store all our blood, and we keep saying that it's like a low pressure system. Well, the way that we get the blood back into like the heart in the first place is not by magic. It doesn't just magically get there. We use the surrounding skeletal muscles. So it's called the muscular pump. So notice that this is a skeletal muscle and this is a skeletal muscle, and it's outside of the vessel, okay? It has nothing to do with the vessel wall itself. It's basically like if like this is my vessel right here, you're basically squeezing the blood and propelling it towards like the heart. It's like taking a tube of toothpaste, right? And the toothpaste inside, you have to squeeze the tube to get it out. That's what's happening here, okay? So that's called the muscular pump. Same thing happens in your thoracic area. Whenever your lungs could expand and contract, the expansion of the lungs is gonna push the blood back towards like the heart and the pulmonary system, okay? Any questions on this?
Is there a specialized muscle or is it just
All muscles,
all of it?
yeah. So like, and that's another reason why like we say to like keep moving, like don't sit for long periods of time, because if you aren't moving, then the blood you're not using the skeletal muscle pump, and it's going to like pool in your legs. Have you guys ever like seen how like in hospitals, in long-term patients who are like bedridden for a long time, they'll put those little pump things on their legs, right? The reason they put those pumps on the leg is because if they're not moving the blood themselves, they need artificial muscles to pump the blood for them, so that it, again, does not pool in their legs. Okay. So regulation of blood flow. There are 3 different mechanisms that we control blood flow. The first is neural, which is, we're gonna talk about something called the baroreceptor reflex. Then there's hormonal controls, which should be reviewed since we did the endocrine system already. And then the renal control, which is a combination of like hormones and like direct control. So let's, first things first, the neural control, okay? So this is for immediate like control of blood, especially when you are changing like body position, right? So the receptors in your body, especially in what we call the baroreceptor or the carotid sinus right here. So this right here is in your heart. If you were in lab with me on Monday, you already saw this, but for those of you who are doing it today, you have your heart, and we said that you have the aorta coming out of it, right? Now the aorta is gonna have a branch that comes off right here. This branch is eventually going to go to the head. This right here, this vessel is called the right common carotid. And where the right common carotid splits from this right here, which is your right subclavian, you have like a set of like receptors right here that detect how much blood pressure and blood flow you have going to your head, okay? So you have them in other areas as well, but that's like the most common site is that carotid sinus. So think about any reflex that we have, right? In any reflex, you have a receptor, right? That receptor sends information to a control center where you decide what to do about it, and then it goes to an effector. This carotid sinus is the receptor, okay? It receives information about your blood flow or blood pressure. It then sends information to the brain. So right here, we said that we want the blood pressure to be normal. This is showing that if you imbalance and you increase blood pressure, you're going to increase signals sent to your brain. Now, think back to semester 1 in the nervous system. What part of your brain contained your cardiac or your cardiorespiratory centers? Does anyone remember? Part of your brain stem. So what's the inferior-most part of your brain stem called? The medulla. Okay, so the medulla, which is like part of the brain, is the specific area that controls or like responds to this reflex. It's going to send information to your heart. If your blood pressure increases, that means you're having too much force in your blood. What do you think we're going to want to do to the heart to counteract that? We're going to want to slow it down, right? If your pressure is too high, we're going to try to slow the heart down to kind of counteract that. So you can see right here, you're going to decrease sympathetic impulses, and it's going to decrease your heart, decrease heart rate, decrease contractility, which is basically saying that it's not going to like contract as hard. At the same time, it's going to go to your vessels. What did we say the number 1 parameter that affects resistance is? The radius and diameter, right? How wide it is. So what we're going to do is we're going to vasodilate the blood vessel. We're going to make it wider to accommodate that increased pressure. Okay? So it works the opposite way. If you decrease your blood pressure, you're still going to send information to that carotid sinus, still going to send information to the medulla, but instead of decreasing heart rate, now we're going to increase heart rate, and we're going to vasoconstrict our vessels. okay? So whatever like happens to your blood pressure, your body's going to automatically try to adjust to that by doing the opposite in your hearts and your vessel like diameter, okay? Now, if this usually happens like second by second, right, in your body, they say that if you go from sitting to standing, right, when you go from sitting to standing, should you feel lightheaded? No, you should be able to do that, well, not today. But when you do it normally, right, when you're going from sitting to standing, you should be able to do that no problem, right? You should be able to like change your body position. That's because this is happening. And they say that this should equalize. It takes about 3 minutes for it to completely go to normal, okay? So if you're trying to figure out like, is your blood pressure, like is this reflex working, you want to make sure that you have been standing for at least 3 minutes, then measure your blood pressure, because if you do it before that 3 minutes, then this is still in progress, okay? Now, if you happen to stand up and get dizzy, then that means that this is not working fast enough, and that leads to something called orthostatic hypotension. Orthostatic hypotension is basically when you stand up, the blood is gravitating and pooling down at your feet, which means that your blood pressure is dropping, right? And your blood pressure, if it drops, we said that your vessels are supposed to constrict and your heart rate is supposed to increase. If this doesn't happen fast enough, then you're going to have decreased blood flow to your brain, which is why you feel dizzy. Okay? So, any questions on this reflex or how it works? Okay, this should be a review from the endocrine chapter that you guys just finished your test on. So there are several hormones that increase blood pressure. There's only one hormone that decreases it, okay? So first, epinephrine. What did we say the function of epinephrine was? Overall, its function was to prolong that sympathetic response, right? It's part of the stress response. You have first the sympathetic system, and then you have epinephrine, and then you have cortisol, right? So that epinephrine, since it's prolonging the sympathetic response means you're increasing blood pressure, okay? Now, aldosterone, what did we say the overall function of aldosterone was?
Retains sodium.
It retains sodium, secretes potassium, right? But when we want to focus on it retains sodium, what is the rule between salt and water? Water follows salt, right? So if we're bringing in and we're like keeping the salt in our body, that means we're keeping water in our body. If we keep water in our body, that's going to increase the amount of blood, which is going to increase the amount of pressure. Does that make sense? Okay. Same thing with antidiuretic hormone. This is, again, water reabsorption from the kidneys. We're basically retaining and keeping water in our body. If you increase your blood volume, you're going to increase the blood pressure. Okay? And atrial natriuretic peptide is the exact opposite of antidiuretic. Okay? So this is going to initiate like water output. So you're basically, it's going to cause you to pee more. If you're losing that water volume, then that means you have less blood. You're going to have decreased blood pressure. Okay? Any questions on these hormonal controls? I can see that you love revisiting the endocrine system. We're going to see the endocrine system in basically every chapter from now on because it is like affecting everything.
Maybe I'll
yeah,
finally
I'll-
get it by the end of the
all in
semester.
there for today.
Yeah, if we keep reviewing it, maybe I'll finally get it by the end of the semester.